A huge number of people go to dentists for treatment. Just because they brush their teeth incorrectly, they have to allocate time in their busy schedules, worry each time about the upcoming injection in the gum, and spend from 5 to 100,000 rubles to restore just one tooth. And sometimes they even have to endure the pain from that dental drill. But you can go to such procedures 5 times less often if you just start brushing your teeth correctly. Now I will briefly tell you how to choose the right toothbrush, whether you need to clean your tongue, how many times a day you should brush your teeth, and which toothpaste to choose. According to the World Health Organization, up to 60% of the adult population is susceptible to periodontitis. Tartar that appears on your teeth leads to periodontitis. It causes a perfectly healthy tooth to sink into your gum. It becomes exposed or loosens and very often falls out, and such tartar forms due to poor brushing. Today I will tell you how to avoid all of this with one simple action by starting to brush your teeth correctly. First, I would like to start with the general rules of brushing teeth. And the first rule is controlled brushing. What this means is that you should brush your teeth right in front of a mirror. Take the brush, stand directly in front of the mirror, and monitor every movement of your brush. The next rule is quality, the control of brushing with your tongue. That is, you check your teeth with your tongue for roughness or smoothness. If you feel roughness, then you simply clean that area again. When should you brush your teeth? Teeth should be brushed daily after every meal. But in life, in practice, of course, this is not always possible. Work, a busy schedule, you're watching YouTube, it's not always possible. Therefore, teeth should be brushed in the morning and evening. But if you also, of course, add rinsing your mouth after every meal during the day or between your brushings, morning and evening, and between each meal, this will greatly reduce the risk of tooth and gum disease. I've heard from some dentists that teeth should be brushed in the morning right after I've had breakfast. Is this true or not? This is, of course, absolutely true. This is actually one of the most common mistakes. And even, let's say, in general, in such an informational field, this is supported. It is believed that in the morning we should get up and brush our teeth, but in fact, this is incorrect. Firstly, it's incorrect because when we wake up in the morning, our mucous membranes are very dry. And if at this time you haven't even had a glass of water or somehow not just rinsed your mouth, start brushing your teeth then, all the elements of the toothpaste. There are not only beneficial but also harmful elements for our body in the toothpaste, and they start to be absorbed. And it's a big mistake when we brush our teeth before breakfast. What does this mean? It means that we brushed our teeth, had breakfast, drank coffee, and heaven forbid, smoked a cigarette, then went to work or about our business. Food particles that remain in the oral cavity are where microorganisms develop, and it is precisely these that lead to the softening of our enamel and all possible diseases in the oral cavity. Cavities and periodontitis develop precisely because microorganisms destroy and infect our oral cavity. So it is essential to brush your teeth after breakfast. After we have had breakfast, done all our tasks, and only then brushed our teeth. And with this clean oral cavity, we go to work or attend to our affairs. Let's say we go out into the world. How do we choose the right toothbrush? Well, we need to start with the fact that there are 3 types of toothbrushes. A soft toothbrush, a medium hard toothbrush, and a hard toothbrush. A soft toothbrush is very often used for patients with extremely sensitive enamel and equally sensitive gums or weak gums. That is, when a patient has a tendency for gum bleeding, or in general, the gums indeed bleed. Since a soft brush is gentler on the gums, a medium hard toothbrush is actually optimal, meaning it removes dental plaque very well without causing injury to our gums. Therefore, this brush has gained trust and is the most common. A hard toothbrush is used for patients who have healthy enamel and gums. That is, when the tooth enamel is healthy and strong and the gums are equally strong. A hard toothbrush can also be used for cleaning removable dentures, such as when there is persistent and hard to remove plaque on the denture. When choosing a toothbrush, you need to thoroughly consider your specific situation in order to effectively and efficiently ensure optimal oral hygiene and maintain cleanliness of your dentures and oral cavity. What are your gums like? What is your enamel like? And what is the current condition of your oral cavity?
Does it really matter at all which company's toothbrush to buy?
If we talk about my personal opinion, I think it doesn't. There is no difference in manufacturers and brands. Most often all this is determined by trial and error. Therefore, there are in fact completely budget-friendly brushes that work just as well as any expensive or more advertised brush.
I don't change my brush every 3 months. Let's say I change it every 6 months. Could this really affect my health in some way, or perhaps in a way I haven't considered?
In my personal opinion, to say that it will affect your health directly in some instant way, well, of course not. It's quite difficult to track this. A toothbrush over a long period can become a source of infection, as microorganisms indeed live on it. These microorganisms can reinfect your oral cavity or in general cause some inflammatory processes. So a toothbrush that hasn't been changed for a long time is a source of infection. And here, of course, I'm not even mentioning that a toothbrush used for a long time becomes technically, let's say, unfit, and it no longer performs its cleaning function properly and effectively as it did initially. Therefore, it's better to replace the toothbrush and under no circumstances use it for an extended period. The next tool for cleaning teeth is an electric toothbrush. In my personal opinion, an electric toothbrush cleans dental plaque better than a manual toothbrush. Firstly, this is because the number of movements an electric toothbrush makes per minute is, of course, much greater. That is, while we would need to make many such movements. Manually with a toothbrush, an electric toothbrush has this programmed in. Secondly, it's about the movements that are programmed. In an electric toothbrush, they are specifically designed not to cause injury to our gums and to be gentle. On the enamel.
I've never used an electric toothbrush and have always used a regular one that I bought at the store. And is it really worth it for me to buy an electric one, to start using it, and is it definitely worth it?
Speaking from my own personal experience, in an ideal situation, we should combine both. And by that I mean, we can brush with an electric toothbrush several times a week. And also complement it manually. An electric toothbrush should be part of your hygiene arsenal. I repeat, it really cleans dental plaque very well, which is a very important tool in the prevention of periodontal diseases. What is the periodontium? It is the tissue that surrounds our teeth, of course. And then there's the irrigator, which is familiar to some and completely unfamiliar to others. Some even avoid it, although almost everyone knows about it, but they don't use it. This is very important in our hands. Tools for dental health. What is the essence of our irrigator? It is, let's say, a device with a reservoir. In it, we pour water, close it, and pull. By pressing the button, water is supplied from the tip under pressure, meaning regular boiled water, or sometimes you can even use tap water. So, the task of our irrigator is primarily to wash out the interdental spaces, those very interdental areas. We wash away the plaque and food residues that have accumulated between our teeth. The irrigator is also very helpful with artificial constructions. These are crowns or bridges. Most often, of course, bridges when there is some space between the crown and the gum, especially when it's a bridge. Food also gets stuck there, and it's quite difficult to wash or clean it out. That's why the irrigator is very helpful in this regard. It helps very, very much. Very often, the irrigator can be one of the good preventive tools for periodontitis and periodontal disease.
So if I don't have dentures or bridges and I have my own natural teeth, then is the irrigator essentially a replacement for dental floss, or are they different things and should they be combined?
That's a very good question. In fact, an irrigator will not replace dental floss, and dental floss will not replace an irrigator. So the irrigator is, let's say, for those spaces we can reach, while dental floss is for those spaces that are, let's say, very, very narrow, where indeed water pressure simply cannot dislodge plaque from there. Well, the next thing, as I already mentioned, is dental floss. Dental floss is a very important tool in the prevention of cavities, especially in the prevention of so-called contact cavities. It simultaneously affects two adjacent teeth and the use of dental floss. It allows us to effectively and efficiently penetrate between the teeth and thoroughly and completely remove plaque. Sometimes even some initial tartar, and potentially to ensure that no cavities form there. The main mistake in using dental floss is, of course, injuring the papilla or injuring our gums. The main rule for using dental floss: we wrap the dental floss around our fingers, and when inserting the dental floss, we do it until a click. This specific click, you will always hear it or the sound of it slipping through, and that's where you stop. Do not go all the way to the end. Do not injure the papilla. And let's say our task is to wrap the tooth, so to speak, on one side, then turn it, wrapping the tooth on the other side with the dental floss. This way, you clean all the teeth, the interdental spaces, and reduce the development of so-called contact caries. The next stage of tooth cleaning is completely non-obvious and sometimes even unconventional. This is tongue cleaning. Many people don't even know about this. Toothbrushing should always end with tongue cleaning, as plaque accumulates on the tongue just as much. But a large number of microorganisms also accumulate. Why are these microorganisms harmful? Yes, because these same microorganisms cause our cavities, meaning these microorganisms multiply in the same way. They settle again on our teeth throughout the day, and they start to soften the tooth enamel. It's the same as with the plaque that accumulates on the teeth, so it's not particularly different, meaning our task is to ensure that the oral cavity is minimally colonized throughout the day. Let's call it minimal, or to have a minimal presence of microorganisms in the mouth. For this, you can use a special toothbrush or tongue scraper. Alternatively, you can use your regular toothbrush, the one you use to brush your teeth, but it's essential to clean your tongue. This is very important in the prevention of cavities. Which toothpaste should you choose? Well, actually, there are quite a lot of toothpastes, and when it comes to choosing, of course, we first follow the recommendation of a doctor. If you don't have such a recommendation, then we look at our needs. If you have bleeding gums, you use a specially formulated toothpaste, such as one that is specifically designed to help strengthen the gums. If your sensitive enamel reacts to acidic or cold substances, you can use a toothpaste that is specifically designed to help with these issues. Toothpaste to enrich the enamel or to reduce enamel sensitivity. The main principle of using toothpaste specifically in toothbrushing is, of course, combining. What does this mean? It means that in your arsenal, you should have at least 2 toothpastes a day. This is primarily because you can address simultaneously 2 tasks. That is, you can brush in the morning with a whitening toothpaste with a whitening effect, and in the evening, for example, brush to strengthen the gums. And the second principle of using such toothpaste is, of course, to ensure that our microorganisms do not get accustomed, since all toothpastes contain substances that, let's say, affect or kill the microorganisms themselves, and our microorganisms are actually very resilient and they adapt very quickly, getting used to it here. We also create such a combination so that our microorganisms do not get used to the toothpaste. And it's also better not to change it more than once, every 3 months. Simply choose a completely different one from another manufacturer or a different paste from the same manufacturer. And now I will tell you how to brush your teeth properly in a moment to avoid injuring the gums and to effectively clean plaque. And most importantly, so that your teeth serve you for a very, very long time without any harm. The first thing we need to start with. Let's imagine that this is our tooth, the visible part of our tooth. Yes, with enamel, our enamel goes into our gum. And let's say the sleeve of my coat will be the gum. Here is our tooth, and here is the gum. We start with what are called sweeping motions. That is sweeping. If we are talking about the lower jaw, then it's from bottom to top. If we are talking about the upper jaw, then it's the opposite, from top to bottom. This is a very important point. It is indeed one of the most, let's say, well, truly fundamental and very important. In education and plaque prevention of cavities, sweeping motions should be done at least 5 to 6 times in one spot. You should look at it as if you want to pull the gum back onto the tooth. So with your toothbrush, just like this, and no other way. Under no circumstances should you do otherwise. These are the movements along the toothbrush. By the way, this is often shown in some TV commercials. Absolutely not. Not with these movements, not with these up and down movements. Do you see what I'm doing with the gum? That's exactly the problem. Gum recession, or as we call it, recession or gum lowering. It's not only sometimes age-related. There are also several other factors that can lead to this recession. But improper brushing, such as physical trauma, this papilla, which hugs, or let's call it a cuff, that hugs our tooth, that's exactly improper brushing. It results in trauma, it injures our gums, which start to recede or lower. Also, improper brushing. If we brush incorrectly, we push it onto the ice, right under our gums. Here is our tartar, and here is our subsequent periodontosis and periodontitis. Because tartar goes away. Periodontosis or periodontitis is nothing more than an infection that has gone deep into the pocket. So it's very important to learn how to brush your teeth. Again, I emphasize with sweeping motions. I repeat, the lower jaw from bottom to top, the upper jaw from top to bottom. No less than 5 to 6 movements in one spot and then move on. Certainly, this manual skill needs to be developed. It's not a 1-minute task, so first the inner surface, then the outer surface of the teeth, and of course, definitely the chewing surface. Our cusp just the same, with the brush. You can finish with circular motions, that is, we start in any case, as I mentioned with you. That is, you can finish with circular motions when we can use direct circular motions with you. Even capturing the gum, brush your teeth from the outer surface to the inner, and at the same time, it will be like that. We will go over the surfaces once more, and at the same time also massage our gums. Also, if we talk about some, let's call them life hacks for effectively brushing your teeth. This is, of course, one of the rules that we start brushing our teeth from the inconvenient side. That is where it's inconvenient for you to brush. And some people are left-handed, some are right-handed. Therefore, we start from the inconvenient side, never from the convenient one, because most often we brush the convenient side for quite a long time. But the inconvenient side is brushed instinctively and quickly, so we start with the inconvenient side and finish with the convenient one. These are the main rules, which are seemingly very simple and quite straightforward indeed. Let's say they will preserve your teeth and greatly minimize a large number of diseases of the oral cavity. Despite the rules and the tools you learned about today, visiting the dentist remains mandatory. Once every 6 months or twice a year. You must definitely visit the dentist. Of course, this is primarily necessary for the dentist to monitor how correctly you are doing it. It is also necessary for the dentist to advise you on how to do it better. Additionally, of course, the dentist will make adjustments with their tools. Sometimes it happens that the dental calculus that forms on a patient cannot be cleaned by anything else. Only special devices and tools such as ultrasound or airflow, the so-called sandblasting cleaning, can do it. Therefore, visiting the dentist once every 5 months is essential. We are only happy when a patient comes to us and everything is fine with them. If you follow at least some of the recommendations you heard in this video today, I am sure that you will have significantly less tooth decay, pain, and the need to have teeth extracted, and you will smile without hesitation and enjoy the food you want much more. Subscribe to my channel to visit the dentist less often, give a like, and I would be interested to know what new things you learned for yourself. Write in the comments. All the best to you and take care of yourself.